Welcome to myeyecademy.com. I'm Professor Mahfooz from Pakistan. In video TOACS 6, we are going to talk about the Catract set, which means the instrument used in the cataract surgery. Possible TOACS questions are: what are different instruments in the cataract set and what are they used for? For the simplification, I've divided them into 6 types of different instruments in the cataract set. One are the syringes, and we'll see what syringes are. They're needle holders, which are to hold the needles. Then some long cylindrical instruments. I've just given them long cylindrical instruments so you can recognize it during the talks or viva. One of them is squint hook, a lens dialer, which is used to dial the intraocular lens, wire vectors, which is used sometimes to take out the lens out of the eye, blade handle on which you fit the number 15 blade, and 3.2mm knife, which is used in phaco and smacky, and crescent knife, which is used in smacky. Then the fourth one is there are some scissors in the set, some forceps in the set, and the miscellaneous instruments in which there is a speculum and irrigation and aspiration cannula, which we're going to see in a second. Welcome to myeyecademy.com. We are going to discuss about the cataract set, the set that is used in the cataract surgery normally. For your ease, I've divided them into 6 different groups, the instruments. These are the syringes, number 1. Number 2 are the needle holders. Number 3 are the cylindrical instruments that I'm going to describe in a minute. Number 4 are the scissors. Number 5 are the forceps, these 3 forceps. And number 6 are these miscellaneous instruments. So I'm going to do them one by one. First of all, syringes. This is 1 cc syringe and it has got a needle on it. So the needle is bent to do the capsulotomy or to make a hole in the anterior capsule for the cataract surgery that we call cystotome. This is the viscoelastic. This is the one that we use to inflate the eye during the surgery so that the eye keeps formed. This is a normal 5 cc syringe which has got a cannula on it, and that is used to do the hydrodissection or to wet the cornea during the surgery. So this is the first set of the instruments that you see in the cataract set. Second one is the needle holder. Usually there are 2 needle holders, a small one and a big one. The small one is for the small needle and the big one is for the big needle. We normally don't do it for the phacoemulsification and smacky type of cataract surgery, but in the extracapsular cataract surgery, we put the stitches and use the needle holder to hold the needle. Then these cylindrical instruments. This one, which is bent at the end, is called squint hook. This one with a ring at the end is called wire vectors, and it is sometimes used to remove the lens from the eye. This one, which is straight and cylinder, is called iris repositor. Sometime during the surgery, the iris can come out, so we can reposit it back into the eye. This one, which is little sparky at the end, this is called dialer. This is used to dial the lens. When we put the IOL or the implant in the eye, then we dial it with the dialer. This one is empty at the end. What we do is we put the blade at the top of it, and that's for the cutting. This is called needle holder. Then are 2 knives. This one is round at the end and it is called crescent blade that we use for the smacky, and this one is 3.2 keratome that we use for the phaco. So these 3, and the 4th one are the scissors. This is the big scissor. This is a 2 spring scissors, the small spring scissor and the big spring scissor. The big spring scissor is used to cut the conjunctiva, and the small one is used inside the eye to cut the iris or the capsule at times. These ones are the forceps. There are 3 forceps here. This one has got teeth on it and it is called tooth forceps. These 2 don't have any teeth on it, and these are called plain forceps. The plain forceps are used to insert the intraocular lens inside the eye, while the tooth one is used to hold the eye during the surgery. The 6 types of these miscellaneous instruments. This is the speculum. We put it in the eye and it goes in like this and opens and retracts the eyelid, so the eyelids remain open during the surgery. This one is a Simcoe cannula, which is irrigation and aspiration cannula. Irrigation and aspiration is used to remove the cortex from the eye. And this little thing is cannula. We attach it with a syringe like this, and the water jets can go inside the eye or to do the hydrodissection, or sometimes we use it to wet the cornea. Thank you very much for being with me, and hopefully that will be helpful. Thank you very much for being with me, and do visit youtube.com at Professor Mahfooz 7544, and please do give your feedback. Thank you.